vision of the Mahalia Jackson Center and of the Early Childhood and Family Learning Foundation as a whole is to recreate communities. I think one of the surprises that came to all of us was how all the different systems had to fit together. We had to have all those programs that were going to help the rest of the family. We had to have a place where we could teach people how to get their GEDs, where they could get job training, where we could give them mental health service or physical health services. What we found was that there were a lot of people who didn't have child care here in Central City, and because they didn't have child care, they couldn't even go out and look for a job.
All right, good job.
So the Early Childhood Foundation came up with gaining partnerships with Head Start, the school board, and state systems such as WIC, food stamp, things like that. I think it'll provide the children the things that they need to get stronger in this environment.
We're going to start off our phonics lesson, and we're going to go, who let the A's out? Who let the B's out?
The advantages that we have with working in a collaboration like that is its tracking. You see what happens most time in early childhood, children get lost in the system. Then the question starts to happen, well, what happened? What happened to this child?
Birth to 5 is very critical in what we do here at Mahalia Jackson. When you do the birth to 5 piece, you let everybody start school on an equal level. We're touching maybe 1/10 of the population in Central City right now. Our goal is to touch 100%.
How many kids we have today?
18.
Wow, a full house. The Early Childhood and Family Learning Foundation provides educational outreach to child care centers in the Central City community. Head Start can only service so many children. If we're going to finally reform education, then we need to get out from the office and go out there and where the children are. What are some of the things that Ms. Janice has taught you? Can you tell me?
Writing their name. I'm Rick.
You write your name? Can you write your name for me?
Yeah.
We want to afford these children an opportunity to have skills that are needed for school readiness. We could say they are ready for kindergarten in the sense that they understand the letter concepts, they understand print. We don't want to see a difference between what happens at Mahalia Jackson and what happens here. And that's why it's so important that Mahalia Jackson, being a model center, is a successful model center.
It was difficult to get people to believe in this. And all I ever heard was, but this is New Orleans. You know, this doesn't happen in New Orleans. The second part of the difficulty in doing this was to bring together 15 on-site partners from all these different agencies to live in harmony in one place. We had to ask people to do lots of compromising.
I just think that we need input on agenda items because thus far that hasn't happened. You all are driving the agenda, so if you could get all the partners to have agenda input.
Or maybe what we can do is each partner can maybe host. If we're going to do these meetings once a month, you know, each partner can host for that particular month. And then they can host that meeting and drive that meeting and, you know, highlight what they're doing.
And when we started talking in terms of children and families and what they needed and getting equality in place, turf became much less of an issue.
Knock, knock. Hi, Miss Mahan. How are you? It's really important to be able to incorporate everything into health because it's actually estimated that as a physician, I only affect 10 to 15% of my patients' health. Most of their health care happens outside my office, outside of my care. So to be able to have all of the things that I need my patients to have access to, quality preschool and Head Start education, food stamps, there's a library, community center, to have that all in one facility, it's pretty impressive. All right, big girl, you want to hop down? All right. I see you after you turn 4, okay?
Okay.
When you come in and you see folks getting medical care, you see these kids who would not have been getting any services, how could you not want to be here? But I think the proof is going to be in time, how many people's lives we've changed, and we're not near there yet.